So I'm a nurse. I've been a nurse for 10 years. I've been in healthcare for 15 years, and I've been serving patients in Santa Clara County for 5 years now. We have a $1 billion shortfall for the Santa Clara County hospital system. That's 4 hospitals. That's Valley Medical Center, Regional, O'Connor, and St. Louis. It's going to be really ugly. It's already starting to come down the pike with us. They are furloughing nurses across the hospital system and running the service staff in the hospital short-staffed, which is impacting the care that patients are receiving. It makes the jobs for the caretakers more stressful. It impacts them financially as they're being furloughed. And we're seeing worse patient outcomes because patients are sitting in emergency rooms when they've already been admitted to the hospital, and they're not getting the specialty care they need on the units they've been admitted to because those nurses have been furloughed. And this is just the beginning. The real budget shortfall starts with the next fiscal year, next year. People are going to die that would not have died otherwise because of this big, beautiful bill. There is a measure for Santa Clara County, Measure A, that's on the ballot this November. It's a 5/8 cent sales tax increase. It is something that's projected to make up about $300 billion of that budget shortfall. So it's a Band-Aid for a really, really deep cut. It's not going to solve the problem, but it's something, and it means fewer services being cut, maybe more staff being available to care for your loved ones. And so it's something that I would encourage all of you, if you're Santa Clara County voters, to vote yes. Real quickly, there's an article in the Palo Alto online about an incident that happened at Stanford. The ICE Gestapo kidnapped a woman, and she had a medical event during that time. She was admitted to Stanford. I can't speak to it personally because I wasn't there. I don't work at that hospital, but I would encourage you all to go look up how ICE is brutalizing the people that they're taking hostage and what occurred within that hospital as far as denying her access to her lawyers per the article, denying her access to her family, to visitation, her possibly being discharged from the hospital earlier than she should have been, according to her primary care physician. Go read on Palo Alto online about this incident. And lastly, I just wanted to again go back to Proposition 50 and reinforce what we've said here. We are living in 1933 Germany. We are living in 2001 Russia. And what that means is we are living through a phase of authoritarian consolidation in this country. If we don't take back both chambers of Congress next November, our country is on a decade or two of fascism in front of it. The decision will be made in next year's elections, and if Proposition 50 doesn't pass, we are already cooked on it. So please get out and vote for it. It's the best thing we can do to combat what's happening, the gerrymandering in Texas. And if we don't take back Congress next year, it's the end of everything that we thought of our country being for a long period of time. So get out and vote. Vote for Proposition 50, vote for Measure A, and make sure you're ready to get out and vote in force next November, okay? Thank you all for being here.
Thank you.